Good evening. I am pleased to welcome you to this special edition of our webinar to celebrate family doctors. In 1954, Victor Johnston said, and I quote, "If the family physician didn't exist, it would be necessary to invent him." Therefore, you may want to ask, who then is this family physician? What are the unique attributes of family physicians? Why do you need a family physician? And lots more. This edition of our webinar is in partnership with the Society of Family Physicians of Nigeria to mark the World Family Doctor Day. And we are happy that you have taken time to be with us on this webinar. This edition of our webinar is important, and this evening we shall be looking at the family doctor caring for you all of your life. To do justice to this topic is a family physician who works with the Department of Hospital Services in the Federal Ministry of Health, Nigeria. She has over 16 years in healthcare service delivery experience and also experience in health system management across the private and public health sector in Nigeria. She is a fellow of both the Royal Society of Tropical Medicine and Hygiene and the Royal Society of Public Health. She currently serves as the Public Relations Officer of the Society of Family Physicians of Nigeria, Federal Capital Territory, Kefi Zone. She's no other person than Dr. Adaeze Oreh. I really advise you to listen attentively, to jot down salient points, and write down questions that you will have opportunity to receive answers to at the end of the presentation. Please stay with us as Dr. Adaeze Oreh speaks on the family doctor caring for you for all of your life. So now, over to you, Dr. Adaeze Oreh.
Good evening, sir. It's my pleasure to be here on this webinar. And thank you so much, sir, for that glowing introduction. I hope I live up to it this evening. Thank you to those who have joined us. And spend the next 1 hour with us while we take you through the family doctor caring for you all of your life. I'll start with a quote, and this is from William Osler, a Canadian physician who was one of the founding professors of the internationally known Johns Hopkins Hospital. And he said, "The good clinician treats the disease, but the great clinician treats the patient." And in family medicine, that's one of the things we take pride in, the fact that we look at the patient in his or her entirety and not just at the disease condition that may be ailing him or her at that time. So I'd like to start with an outline, just to give you an idea of the things we'll be discussing this evening. First of all, I'm sure the question burning in many of your minds is, who is the family doctor? This weekend we'll be celebrating the World Family Doctor Day, and I know that in many spheres you'll be hearing about family doctors, but the question may be, who indeed is the family doctor? What is family medicine? What are the characteristics of the discipline, and what is the particular uniqueness of the family doctor? What's the 6-star doctor? What are the skills that family doctors have? What's the importance of having a family doctor? How do you get a family doctor? And what are those things to look out for when choosing a family doctor? So we'll start with, who is a family doctor? And a family doctor is a physician who is primarily responsible for providing comprehensive health care to every single individual who seeks medical care. And the family physician also arranges for other health professionals to provide care when this care is necessary. The family physician is educated and trained in the discipline of family medicine. So family medicine is a specialty of medicine similar to pediatrics, obstetrics and gynecology, and surgery. But of course, with a particular difference, and that's why we're having this webinar this evening. So the family doctor possesses unique attitudes, unique skills, and a knowledge set that qualify him or her to provide continuing and comprehensive medical care, health maintenance, and preventive services to each member of the family. Family medicine is a specialty, like I said before, and this is a medical specialty that provides this continuing and comprehensive health care for the individual and the family. And when I say continuing, I mean from when a patient is a child to when that patient may be elderly. That is the breadth of the family medicine specialty. It encompasses all ages, both sexes or genders, each organ system, and every disease entity. And it integrates not only the biologic sciences, but also the clinical and the behavioral sciences. So social issues are some of the things that family physicians, family doctors also take into consideration in providing care. So this discipline integrates several medical specialties into a new whole. It's concerned with a holistic approach to patient care and looks at the individual in totality of the context of the individual, his or her family, and also the community. So the family doctor provides care that is personal, comprehensive, continuing, and coordinated in the context of the family and the community. So where the services of other health professionals may be needed, the family doctor is happy to link the individual and the family with such care and coordinate the care. That means the family doctor must be the patient's advocate, must be competent, must be caring, and must be compassionate. So this shows you a pictorial representation of the breadth and the span of the continuous care that the family doctor provides, from when a woman is pregnant to when the baby is born, different stages of childhood, growing into a young adult, an adult, and even elderly, up until the demise of the individual. So from the cradle to the grave, and even beyond, in supporting the family members who have been left behind. So now we're going to take a poll, and the first poll is for you to engage with us and tell us, do you currently have a family doctor? So the answers would be either yes, you have a family doctor, or no, you don't have a family doctor. I hope you're registering your answers with us on the poll. We'd also like to talk about the characteristics of the discipline. And this discipline of family medicine is normally that first point of medical contact within the healthcare system. And it provides open and unlimited access to its users, dealing with all health problems, like I said before, regardless of the age, regardless of the gender, or any other individual characteristic. It makes efficient use of the available healthcare resources through coordinating care, working with other professionals in the primary care setting, and by managing the interface with other specialties, taking on an advocacy role for the patient when needed. This many patients find to be helpful because the healthcare system can often be confusing, to people who are navigating it for the first time. And this is where the family doctor comes in, by helping the individual access the system in a manner that is acceptable and helping to coordinate through different appointments and generally navigating the health system. So there's the development of a patient and person-centered approach that is orientated towards the individual, the particular family he or she comes from, and their community. The discipline has certain characteristics, and one of these is that it promotes patient empowerment. So the patient, the individual, and the family feel particularly empowered because there's good flow of communication between the family doctor and the individual and the family. There's a unique consultation process, which then establishes a good, strong patient-doctor relationship over time. And this comes through effective communication. It's responsible for providing continuity of care as determined by the needs of the patient. And there's a specific decision-making process that is determined by the prevalence and incidence of illnesses or diseases in that specific community. And at the same time, the family doctor would be managing both acute or emergency conditions and even chronic health problems that have been happening to the individual over a long period of time. It manages illnesses that present in an undifferentiated way at the early stages, and there's a specific responsibility of the family doctor to the health of the community. So there's also promotion of health and well-being, both by making sure that the appropriate interventions are used that are effective for whatever the condition may be. And then it deals with health problems in their physical, psychological, social, cultural, and even the existential dimensions. So it's not just the pure science, it's also social issues that are taken care of by the family doctor. The uniqueness of the family doctor is that the family doctor is not only a clinical leader and consultant in the primary healthcare team, but this specialist has a comprehensive set of skills that are adapted to the individual circumstances, local needs, the available resources and facilities, and also based on the competency and limitations of the practitioner. Referring on patients who may need some other specialist care and coordinating that care. So the family doctor, we like to think, is the custodian of individual health care. The family doctor has a commitment and a responsibility to a defined population to whom he or she is accountable. The family doctor collaborates closely, ensuring that with teamwork, other members of the primary healthcare team are supervised and carried along in the management of the patient and the family. And the family doctor has the central pivotal role in coordinating that primary healthcare team. One of the unique features of the family doctor is that the family doctor is a lifelong learner. And this lifelong learning is based on a commitment to research, auditing our processes, because we have a responsibility to continually educate ourselves and our primary healthcare teams for the best health possible for the individual, the family, and the community. So the family doctor manages most complaints, knows the patient and the family, provides comprehensive medical care that emphasizes this family unit, the unique family unit, and specializes in the patient while providing cost-effective care. In talking about the longitudinal care, continuous care, the family doctor develops a good and lasting relationship with the patient. The family doctor sees the patient from the cradle to the grave, and in sickness and in health, he or she is able to provide quality health care that is relevant at every stage of the individual's life, maybe in childhood, maybe those things that are peculiar to adolescents, adulthood, and even geriatrics, which is elderly care. The care begins even before birth, what we call preconception care, and continues beyond death. So there's end-of-life care for individuals who may be passing on, and even continued support, grief management for the family members who survive the one who has passed on. So, with all these features, characteristics, and I've mentioned regarding the family doctor, we'll take a second poll. And this second poll will be, do you think you need a family doctor? And once again, the answers would be yes, or I think I need, or my family needs a family doctor, or no, I don't think myself or my family need a family doctor. I hope you're voting. It'll be nice to see the results. If I've been able to communicate the benefits of the uniqueness and the importance of having a family doctor to you. So we'll go on with our webinar. And now I'd like to share with you what we call the 6-star doctor. And this 6-star doctor basically represents the family doctor and certain unique features. So first of all, the first star would be that the family doctor is a caregiver. I'd mentioned earlier that the family doctor has to be caring and compassionate, and this is what this star encapsulates. So the family doctor provides care, holistic care, as part of the family. Secondly, the family doctor in the second star is a decision maker. So the family doctor would be choosing which interventions or treatments are most appropriate and which technologies to apply in an ethical and cost-effective manner, taking into consideration the individual circumstances, the family, and the community where the individual comes from. The family doctor will also be a communicator, and in communicating will help to promote healthy lifestyles by advocating for healthy lifestyle behaviors and changes that the individual and the family could benefit from to increase their health and to promote their health and increase their quality of life and their well-being. The next star would be that of a community leader. The family doctor has a responsibility to the health of the community, and by working in the community develops trust among the community members with whom he or she works. The family doctor, as a clinical leader and team leader of the primary care team, works with individuals and the organization, both inside and outside the healthcare system, to manage the resources available for the best possible health of the individuals, families, and the community. And here again, I would like to emphasize the fact that the family doctor is a lifelong learner, constantly seeking for evidence-based medicine that would help in the best possible healthcare for our patients and their families. Now, the family doctor has specific skills, and this skill set comprises being able to prevent disease, promote health, being able to diagnose ailments and conditions affecting individuals, being able to treat those disease conditions. Another skill set would be managing resources adequately and in a cost-effective manner for the individual and the community. And also skills in research to be able to get the best possible evidence that's relevant to the community in which we serve. It's important to have a family doctor, and research has shown that people who have a family doctor have better health outcomes, including fewer deaths from cancer, heart disease, and even stroke. Communities with more family doctors all over the world have been seen to have fewer premature deaths. The benefits and importance of having a family doctor include familiarity. Having a family doctor ensures that your doctor knows who you are, knows the intricacies of your health and wellness, and also is familiar with your family circumstances. This knowledge helps to personalize the healthcare and save time that would have been spent repeating medical history. Because this is one of the things that some of my patients even share, that this prevents them from readily seeking care. The fact that before they got engaged with family doctors, they had to repeat their history over and over again when seeing one specialist or the other. And one thing that individuals, humans, like is the fact that you're treated in a unique and individualistic manner. Nobody wants to be treated like everybody else. So this is one of the benefits of having a family doctor. There's continuity of care. So the family doctor is responsible for providing comprehensive care to the individual and the family, coordinating routine checkups. And because these checkups are with the same doctor, there's a relationship that's built over time, and there's a comprehensive snapshot that the family doctor has of the patient's health, which helps to diagnose illnesses more accurately and also identify risks that may be at play in the individual's life. Managing medications. Oftentimes, different medications are prescribed by different doctors, different specialists. And there's always that chance that some of these medications interact with each other, reduce the effect of each other, or even bring about side effects. So the family doctor can serve as a gatekeeper, keeping track of all medications that are being taken by the individual and noting any changes in the dosages or the frequency that the individual have to take them, and therefore be vigilant about the occurrence of any negative side effects. Time saving. When there's a great relationship with your family doctor, issues that may come up between annual medical checkups can be quickly addressed. And depending on the symptoms, the family doctor might be able to manage the condition even over the phone. Prevention is better than cure. That's a cliche, a quote that everybody knows and everybody says from time to time. But the truth is, prevention is key. And the more your family doctor is aware of your overall health, the more likely he or she will be able to identify any health problems before they even occur. So where there's the risk of heart disease, diabetes, or even cancer, the family doctor can recommend a lifestyle change to help lower that risk. So down to the nitty-gritty, how to get a family doctor. The most common way before technology, age-old system of getting a doctor, was talking to friends and family to get recommendations. But the thing is, that recommendation is limited to the scope of the family or the friend. So that scope is not as wide and doesn't often give many options for the potential family doctors. But with KompleteCare, this database of doctors, www.kompletecare.com, complete with a K, you can go there and actually see the profile of several family doctors and then easily establish a relationship with one of such family doctors, get an appointment, and even have the opportunity of audio or video calls before going in to consult in the facility where the doctor practices. Now, there are certain things that one must look out for when choosing a family doctor, just so that there are no surprises in the course of the encounter or consultation. The first thing is to find out if they accept health insurance for individuals who have health insurance. The second thing is to find out what hospital the family doctor practices and check the proximity to your home or even your office. And that's why this website, www.completecare.com, can help to provide this information. The next thing you may want to know is if the family doctor's office performs lab and imaging tests like ultrasound and x-rays, CT scans. If not, do they refer patients to another facility within your insurance network or near your home where those tests can be done? So, the things to look out for when choosing a family doctor is, first of all, was the office easy to get to? Easy to reach from your home or from your office? Were you comfortable with the doctor? Did the doctor answer all your questions? Did the doctor show interest in getting to know you or getting to know your family member who you may have taken for the consultation? Did the doctor explain things in a way that you understood? And lastly, will the doctor be able to treat you and your family? I would like to conclude by saying that every family should have a family doctor. www.completecare.com is an easy and reliable resource. So there's no excuse to not be able to find a family doctor that suits you or your family. The family doctor treats most of the problems of most of the people most of the time. But it takes time to build a relationship with your doctor. And the cornerstone of family medicine is an ongoing personal patient-physician relationship. And because it takes time, why don't you start now and start saving on that time in future? I hope my presentation of the importance of a family doctor caring for you all of your life has helped to answer some questions that you may have had and been enlightening for you. It's been my pleasure speaking with you this evening, and I look forward to engaging with you on the questions you may have. Thank you.
Thank you, Dr. Oreh, for that engaging presentation. So at this time, we will take questions from the audience. So if you have any questions, please feel free to type it, in the chat box, and Dr. Oreh will take it up from there. And we will not, I don't think we will leave, these questions will not be very specific to just what you've learned. If there's something else that it might be, that you may want to ask about, feel free to ask, your questions.
Thank you so very much, Dr. Ada, for the exciting webinar. I know by now you've all heard what family physician is all about. By now, I believe you understand the qualities of the family physician and also the skills of a family physician. You've been able to understand the scope of practice of a family physician, the benefits of having a family physician. And you've heard it all, what it means for a family physician to care for you for all of your life. You may have questions, you may have concerns. I want you to type it into the chat box. Any question you have, just type it into the chat box, and we will be able to provide answer to those questions. So we're waiting for your questions or your comments. Thank you. Yeah, we've gotten a lot of good comments and compliments from different participants. Daniel, I learned from what you posted that you have learned a lot. We're very encouraged hearing that. Also, Shola, you have just asked a question. How useful is a family doctor going to be to my family if she's far away from us? So, Shola is asking the question of how a family doctor can be useful if the patient or the client is far away from the family doctor. Dr. Lagunju, we've seen your comment. You said the presentation was very enlightening, and we're very happy to hear that. And another person, Dahila, you said, I'm just joining. Could you briefly recap how to start? Before we answer the questions, Dahila is just joining. She wants a very brief recap of all that Dr. Oreh has said. So before we take those questions, can Dr. Ada just give us a 5-minute summary of what she's been speaking about so that those who joined late can come up to speed before we start answering the questions. So over to you, Dr. Adaeze Oreh.
Okay, and thank you very much, sir. I'd like to welcome Dahlia, who's just joining us, and several other people who possibly just joined. Just to give you a recap and an overview, this presentation was the title was The Family Doctor Caring for You All of Your Life. And I started with talking about what the family medicine specialty is and the family doctor who provides continuous care across the life of an individual from what we say the cradle to the grave. So at every stage of childhood, in adolescence, as an adult, and as an elderly person, the family doctor is there to care for the individual. So regardless of age, regardless of the gender of the individual or any individual characteristics, the family doctor is there to care for you and for your family. And the family doctor also helps to coordinate care where the services of other health professionals may be needed as well, just to help as an advocate for the patient, help the patient to navigate the healthcare system in a manner that is cost effective and beneficial to the patient. Now, we also describe the family doctor as a 6-star doctor. So this 6 stars means that the family doctor is a caregiver, the family doctor is a communicator, the family doctor is a decision maker, the family doctor is a lifelong researcher and also a manager. So the family doctor helps to manage available resources for the best health possible for the individual, and also bearing in mind the family the individual comes from and the community to which they belong. Now, the other thing is what those things to look out for when choosing a family doctor. Now, the family doctor should be in somewhat close proximity to the individual's home or office, just so that getting to the family doctor doesn't pose a challenge in terms of the time and distance needed to reach the family doctor. And the family doctor should be one that the individual is comfortable with. The family doctor should be caring and empathetic enough to seek the understanding of the patient in the proposed care and seek to generally understand the patient as an entire individual and not just concerned about the disease or the illness condition. Now, another thing that would be important to look out for is if the family doctor accepts health insurance, and then if there are any facilities where the family doctor's practice can refer the individual for certain tests in the event that the family doctor's practice doesn't do those specific lab or imaging tests. But then the family doctor is basically there to coordinate the necessary care so that the patient is not thrown into the wild of the healthcare system and not knowing how to navigate that system. So, in a nutshell, KompleteCare.com, which is a database with the profiles of several family doctors, is available as a resource that the individual can log on to and see the profiles of the doctors and select one who you think may be most appropriate to yourself or your family, and then follow on with getting an appointment to consult with that family doctor. I hope that has been helpful to you, Dahlia, and any other person who may just have been joining us.
All right, thank you so very much, Dr. Adaeze Oreh. You can now address the question from Peter, who wants to know, in case there is a patient who lives far away from a family physician and there is a geographical barrier or a location barrier, how can that patient still have access to a family doctor?
Yeah, that's a very good question, Mr. Peters or Mrs. Peters. In the event that the family physician is far away from where the individual is, that's one of the benefits of technology of today. And with a resource like KompleteCare.com, when you identify a particular family doctor there, the one who may be closest to your location, you can actually engage with the family doctor and have recourse to audio and video calls where your specific circumstances can be relayed to this family doctor, so that the family doctor knows the best possible way to advise on where and the kind of care that the individual or the family may need at that particular moment in time. That's why having this kind of technological resource that is beyond borders is very helpful for such individuals.
All right, thank you so very much, Dr. Adaeze Oreh, for that answer. We've gotten a lot of positive comments from many of our participants. We've gotten positive comments from Dr. Dota Awala. She says she's impressed with the presentation. Dr. Vivian Okafor, we've also seen the comments you have posted. Dr. Omolara Olagunju, we've seen the comments you have posted. Dr. Nemeka and Daniel Olori and Bukongboa, we've seen your comments. We're impressed with that. In case anybody still has any questions or comments, we will still be here to take those questions or comments. All you need to do is to use the chat box and type your questions or your comments, and Dr. Adaeze will respond to them. Thank you. I want you to feel very free. Just type your question on the chat box and answers will be provided. Or if you have useful comments, that also will be acknowledged.
I'm also seeing a
we
question.
have questions that has just come in now. Nemeka, I can see your question. What about the state-based health insurance that most associations of doctors are not in support of? Can paying out of pocket be sustained in maintaining care rendered by the family doctor? That patient is coming from Inemeka and Yohara. We have another question from Inemeka and Yohara. This app, KompleteCare, has been for over a year now. What is the success rate in its usage over this 1 year? That's another very important question from Nemeka. So, Dr. Adaeze, you want to take a tab at how does health insurance, that from that question, most associations of doctors are not in support of. Can paying out of pocket be sustained in maintaining care rendered by the family doctor? Dr. Adaeze Oreh will still speak, but let me say something about that. While Dr. Ada is catching her breath, she's been speaking for quite a while now. Thank you so very much, Nemeka. The healthcare insurance, you are referring to the state-based healthcare insurance. And your observation is that most associations of doctors are not in support of those health insurance. What I want you to understand is health insurance, either social insurance, state-based health insurance, community-based health insurance, or even the national health insurance, or any type of health insurance at all that is adopted, should be one that brings a win-win outcome. Remember that the purpose of health insurance is to share the risk of payment for sudden or a catastrophic health experience that paying out of pocket may not be able to meet up with. You want to share that risk across participants, subscribers to those health insurance. But at the same time, you want to make sure the providers of those healthcare services are not shortchanged while there is a proper regulation by the regulatory body. I want to believe that all the stakeholders that are involved in the state-based health insurance need to come together and find that middle ground wherein the interests of the patients, the interests of the provider, and other health maintaining organizations are well taken care of. I want to believe that the reason why some of those associations are kicking against the state-based health insurance is because these conditions have not been met. That being said, we know that health insurance is actually the way for financial or economic access to health. KompleteCare is committed to making access to healthcare easy. And by access to healthcare, we're talking about geographic access and financial or economic access. So I agree with you that paying out of pocket is not sustainable. I will therefore advise that all stakeholders involved in healthcare insurance must come to the middle ground where that service is actually a win-win experience for all, including patients, the providers, and also the health maintaining organization. I'm sure Dr. Ada may want to share some of our experience on that question. So, Dr. Ada, I believe you've caught a little bit of your breath.
Yes, I have.
One or two things
yes.
And answer Nemeka on that question.
Yeah. Nemeka, Thank you for that question. I actually smiled when I saw it because it's actually one of the burning issues now. All over the world, everybody's talking about financial access to health, economic access to health, universal health coverage. And it's been like a roller coaster of states signing laws for state-based health insurance, which when looked at on the surface is the way forward for ensuring access of our teeming population of people in the various states of the country to health. But then obviously there's cause for worry. And perhaps the reason why most of the associations of doctors are worried is the fact that mandating this state-based health insurance without clear mechanisms for the payment of the providers of health would just add to the debt burden of the states, with the doctors being at the blunt end, without being paid for offering care, without the facilities being reimbursed for care that they've offered. And definitely that would not be a sustainable system as well. So out-of-pocket payments, of course, is not the option. So like Dr. Ogufonwokon said, the only way forward is for all stakeholders to come together and discuss the possible solutions to this. There must be clear-cut regulatory mechanisms in place to ensure that every provider of care, every facility that's providing care for the state insured should be reimbursed in whatever system of payment that is agreed, so that nobody gets the shorter end of the stick. We should be looking for increasing the quality of care that we provide, and across the value chain of healthcare provision, ensuring that those who provide care are reimbursed for the care that they provide has a way of building the health system and ensuring continued provision of quality healthcare services. So we would see improvements in the healthcare of our people. We will see improvements in the health outcomes from the country, and of course, by extension, the world, because Nigeria, with 201 million people, is a large contributor to the world population. So this is where we should be looking towards, sitting together to design robust systems of care delivery and systems of reimbursement for care provided, so that all our people are taken on board. Thank you so much for that question, Nemeka. I hope we've been able to answer it to some extent for you.
Yeah, Nemeka is very curious, and we are very happy that he has other questions. This app, Complete Doctor, has been for over a year now. What is the success rate in its usage over this 1 year? Let me first of all say that app is KompleteCare, not Complete Doctor. But of course, we have complete doctors who are involved in KompleteCare. The answer I will give you is that on the 19th of May, 2019, the world will be celebrating the World Family Doctor Day. And that day, last year, KompleteCare was launched. And it was launched in 23 states all over Nigeria with KompleteCare doctors. That's a family physician now, because they practice holistic, comprehensive care. So I'll call them KompleteCare doctors who have registered on the platform. And as you look at the curve of progress for a startup in healthcare tech, which KompleteCare is all about, I will say that the success rate of KompleteCare has been very encouraging. I want to tell you that KompleteCare has grown in leaps and bounds, getting doctors, getting hospitals, getting patients, and providing products that have been reviewed, refined, and updated within this 1 year, and has put itself on a landmark position, attracting international collaboration. So for this 1 year, I will just give you a milestone of what KompleteCare has been able to do. In this 1 year, KompleteCare has developed this web app that provides home-based consultation at a click. That service is still available up to today. It started 1 year ago. Also, you can have hospital-based appointments from anywhere you are in any part of the world. That was launched 1 year ago, and that product and that service is still being rendered by KompleteCare. Of course, Shola asked, if my patient is far from a family physician, that is geographic access, KompleteCare has the online audio and video consultation that the patient can actually use to access doctors. So KompleteCare has removed that geographic barrier. And this was launched last year. I want to tell you, even up till now, that service is still available. It has even been updated. Before now, last year, all you can do is to have an instant online consultation. But now you can have instant consultation, and you can also have booked online consultation. So KompleteCare has even improved in the quality of the service that it's rendering. But beyond that, I want to tell you that KompleteCare has added to its products, and some of them are going to be launched very, very soon. KompleteCare very soon will now be providing nursing home-based consultation. Also very soon, in partnership with international companies, KompleteCare will soon launch seamless overseas medical travel when necessary. And all this at a click. So I want to say that KompleteCare has grown in leaps and bounds. So as you look at the curve of progress for a startup, this 1 year will give KompleteCare a pass mark. And we are very excited for those doctors that have made this to happen, for those hospitals that have made this to happen, and for those patients that have made this to happen. And we do hope that for those of you that have been part of us up to now, we thank you for all your support. And for those who are just getting to know about KompleteCare, KompleteCare has repositioned itself to even do much more than it has been doing in the past 1 year. So May 19 is going to mark our 1st year anniversary, and we have repositioned ourselves to improve much more than we have even been doing before. So in a nutshell, to answer your question, in this 1 year, KompleteCare has grown in a very appreciable and commendable way. If you look at the natural curve of progress for a startup, I do hope Nemeka has been able to get that and is satisfied with that. Because we have just about 3 minutes or so to go, let me quickly say that we have been able to address some of the questions. If there are other questions that we've not been able to address, you can go to www.completecare.com. You can actually post some of your questions and concerns there, and we will still be able to address those questions. You can also follow us on our Facebook, on our Twitter, on our Instagram, and also on our LinkedIn. We will encourage you to take the survey that you are going to receive after this webinar, to give us feedback that you've not been able to give us during this webinar, and we'll be very happy to receive your feedback. Let me quickly say that this edition of our webinar has been produced in partnership with the Society of Family Physicians of Nigeria. And the topic we have considered this evening has been family doctors caring for you for the whole of your life. We do hope you've been able to learn 1 or 2 things or you've been able to consolidate some of the knowledge that you have. We do hope you'll be able to join us in our next edition of webinar. We're going to have another edition of webinar in June, and we're going to contact you. We do hope you'll be able to join. We do encourage you to tell your friends, your colleagues, your family members, and those that are close to you about our webinar. The purpose is to empower our doctors, empower our patients, and empower the whole healthcare sector as a whole. Thank you so very much for taking time out of your busy schedule to attend this webinar. This webinar has been brought to you by KompleteCare in partnership with the Society of Family Physicians of Nigeria. We do want to appreciate all our family doctors. We want to thank you for all that you have been doing to care for patients. And we do hope as you celebrate the World Family Doctor Day, that there will be renewed commitment to excellent and quality care. For this 1 hour, I have been the moderator of this webinar. By name, Dr. Oluwagbenga Ogunfowokan. We are so happy, the whole KompleteCare team are so happy for how you have been with us on this webinar. Until we come your way again in our next edition of webinar, thank you for being with us. Goodbye.